Hello everyone, welcome to your lecture on leadership and quality improvement. These are the objectives we will be covering in this lecture. Let's talk about leadership. What is leadership? It's the ability to direct, motivate a person or group to achieve a set of goals, right? Leaders have power to influence a group, which depends on their leadership style, like the group they work with, right? And how that person fulfills the leadership responsibility. So there are two types. We have explicit power and explicit leadership and implied. Explicit is power by virtue of position. For example, a nurse leader that's already hired to be your nurse leader at work, right? Then we have implied leadership. This is power due to other factors such as personality. You'll come across those people who have these very strong leadership personalities and they just draw people to them, right? And so as you can, even though nurses may assume leadership roles by virtue of position, they only become effective leaders over time by understanding the complexities and coordinating care, remaining open to different points of view, and understanding and interdependency of the entire healthcare team. Characteristics of leaders. They're encouraging, they foster and promote positive work relationships. They create environments with open communication and collaboration. They align their focus with the mission, philosophy, and strategic plan of the organization that they work for, right? They develop strategies to align worker talents and the diverse population with organizational needs. They serve as role models. They prevent and resolve conflict. They coach and mentor other members. They implement evidence-based strategies to minimize stress, burnout, and staff turnover. And they prevent behaviors that can lead to hostile work environments. These are some skills that they use to do all of that. That includes empathy and caring, respectfulness, commitment to excellence, problem-solving skills, commitment to and passion for one's work, trustworthiness and integrity, accessibility, being approachable, being accessible, responsibility to enhance personal growth of all staff. These are some different leadership styles and the characteristics. They're transformational, strategic, lateral, quantum, innovative, shared governance, and situational leadership. Please read over some of these characteristics. Now, we talked about leadership. Now, what is a nurse manager, right? They work to achieve organization goals. Characteristics are they are accountable. They have accountability, they're organized and provide evidence-based strategies to address problems. They have leadership skills that include supervising care provided by team members. They provide timely feedback and report feedback to direct reports. That means whoever they report to, right? They serve as a role model and resource. Responsibility is another skill that they have. They delegate care according to the roles and responsibilities of the person. Obviously, they're not going to, for example, they're going to delegate, RN skills to an RN and not, assistive personnel. Authority, they use effective communication to serve as a liaison between groups and individuals, internal and external to the organization. The difference between leadership and management. A nurse leader oversees the team of nurses and other healthcare professionals making decisions, directing patient care activities. They have advanced clinical knowledge and are focused on improving patient health outcomes. A nurse manager, on the other hand, works to accomplish the goals of the organization by achieving safe, effective client care within the facility. They provide skills such as delegation, supervision, critical thinking, and evaluation of overall outcomes. Roles of leadership in nursing, right? We have knowledge of administrative structure, patient care organization, patient teaching, managing and directing care, time management, participation in professional organizations such as the American Academy of Nursing, all of these different organizations. Then they have mentorship and preceptorship. They provide mentorship and preceptorship, continuing education. So these are different roles of leadership that are available in nursing for nurse leaders, right? Then we also have delegation, advocacy, quality improvement, and conflict resolution. So delegation, what is delegation? It's a critical nursing competency and skill. Right? It's when we're delegating a task to someone, right? This is the transfer of responsibility for the performance of a task to another person while retaining accountability for that outcome. For example, I am delegating it to somebody. For example, I delegate vital signs to my CNA, but I am still accountable for the outcome. I still have to supervise that, right? And so there is no aspect of the nursing process that can be delegated. You cannot delegate, the nursing aspects of nursing assessment, the whole process of the nursing, right? Do not delegate this is an acronym that you can use, what you can eat. For example, evaluate, assess, teach. We don't delegate those tasks, right? Always follow the state's Nurse Practice Act. There's a link over here, the Code of Ethics or facility policies. They'll be very clear. Even the Nurse Practice Act and the Code of Ethics is very clear about what you can and cannot delegate, right? The RN is responsible for initial patient assessment, discharge planning, health education, care planning, triage, interpretation of patient data, care of invasive lines, administering parenteral medications. These are just a few of many examples of many different tasks. The RN can delegate basic care activities, for example, like, vital signs, things like that, patient care, like, cleaning the patient, or collecting patient data. For example, like getting the vital signs, putting the input and output in the system, or transfers, like transferring the patient from bed to chair, things like that, if it's safe, right? And post-mortem care. The RN is responsible and accountable for the nursing practice and supervision of the AP, providing the direct patient care. The nurse is still responsible for that. The purpose of the AP is to work in a supportive role to the RN. That's why it's called AP, assistive personnel. So they're there to support the RN. Now, before delegating, just consider the stability of the patient's condition. If the patient is critical and unstable, then no, you shouldn't delegate, right? The complexity of the activity, right? If it's very complex, do not delegate it. The potential for harm is, for example, think about it, like if I delegate this to my UAP, will this cause harm to the patient, right? Predictability of the outcome. If the outcome is unpredictable, then do not delegate it, do it yourself. And overall context of other patient needs. But there might be some tasks that you just have to do as the RN. These are 5 rights of delegation. They're extremely, extremely important for you to remember. They are the right task. Is it within the delegatee's scope of practice? For example, if I delegate vital signs to the CNA working with me, is that within her scope of practice according to the Nurse Practice Act, according to their scope, right? So the routine, frequently recurring tasks, minimal potential risk, these are things that, are considered right. Establish a sequence of steps, which requires little or no modification for the individual clients. For example, if I have steps 1, 2, 3 that need to be done, and it can be done for all clients, then I can delegate it. But if I say, okay, I want you to do steps 1, 2, 3 for this one, but this one might need a different one. So assessing whether that person needs something different is not something that you can delegate, right? So a predictable outcome. Remember, we talked about predictability. Then you have to think of right circumstance. Is this the right circumstance in which I can delegate? Is the client stable? Is the task non-complex? Is there enough staffing and resources and supervision available? Right person. Delegators should assess competency prior to delegating. Before you delegate as an RN a task to the UAP, make sure that they have the competency for it. They know how to do it. Right? They should have the appropriate knowledge, skills, abilities, and competency to do that task, right? Don't just say, hey, go do this, and not check to see, hey, can you do this at first? Find out, right? Right direction and communication, extremely important. Delegator needs to provide clear instructions, specific instructions, client concerns and observations to be reported back or recorded. For example, if you assign vital signs to the UAP, let the UAP know that, hey, if you see any vital signs between this range and that range, any blood pressures above, 160, you need to come and report it to me right away, right? Make that very clear and specific, right? Delegatee should verbalize the understanding. So once you give those instructions, the delegatee, whoever you give delegating the task to, should verbalize that back and say, yes, I understand it, and this is how I'm going to do it, and give them the opportunity to ask questions, right? Right supervision and evaluation. Monitor and evaluate and intervene as needed. Delegator retains ultimate accountability for that task. That patient is still your responsibility. The vital signs are still your responsibility. So if it's done incorrectly, you need to supervise that and change, do it correctly and intervene. What can you not delegate? Initial nursing assessments, follow-up assessments, if nursing judgment is indicated, so assessments, nursing diagnoses, right? Decisions and judgments about outcomes, formulation and approval of a patient's plan of care, right? Interventions that require professional nursing knowledge, decisions or skills, decisions and judgments necessary for the evaluation of patient care. So basically that's your nursing process. RNs can delegate the following things. For example, RN skills, assessment, IV medication, blood administration, planning care, physician orders, and teaching. So you can delegate that to an RN. For example, if you're a nurse working on the floor, you're an RN, and there's another RN who's working on the same unit, and you can delegate an assessment to that RN because that's within their scope of practice, right? IV medication, blood administration, physician orders, teaching, because it's within their scope. For LPNs, you can delegate vital signs, some IV medication, but that depends on the Nurse Practice Acts and the institution policies, right? Because sometimes some facilities require them to have IV certification, certain certifications to be able to administer IV medications. And for an LPN, you can delegate physical care. For ancillary personnel, such as PT, OT, nutrition, and speech, you can delegate tasks that are specific to their scope of practice. And to assistive personnel, you have feeding, hygiene, physical care. Now remember, all of these also, as you're delegating these things, you also have to remember whether the patient is stable, whether it's complex, whether did you give correct, the specific, clear instructions. All those things are important. Now, when you delegate, you have to supervise, and there are 3 aspects of supervision. First is direction and guidance. Once again, clear, concise, specific directions and communications. Clearly articulated specific outcomes. Okay, I need you to, can you please get these vital signs and report to me if this happens, right? So very clear, clearly articulated. Give them the chance to ask questions and clarify anything. Time frame. Tell them when you want it done. For example, hey, I need help with vital signs. Can you get the vital signs for these 5 patients and give it to me before 8 o'clock, right? Give them that time frame. Any limitations, let them know. Hey, if this and this happens, then don't do this, come and call me and I will do it. Notify them of any limitations to that task. Verification and validation of the task. Now, if you're telling the UAP, hey, can you help me with the orthostatic vital signs on this patient? Make sure that you need to do that, right? Verify it, validate that task before, giving it to them. Evaluation and monitoring is the second step of supervision, where you frequently check in. Okay, are they doing this? Okay, are they doing it correctly? You might walk by a room and see that the UAP is measuring, has the blood pressure cuff on their left hand, and that patient has a mastectomy, history of mastectomy on the left hand. You might want to stop them, right, and say, hey, no, we're not going to do that hand. We're going to do that hand. Then that goes back to providing those directions, right? And then make sure you have open, clear, mutually agreed upon communication lines and processes, very clear and concise, and the achievement. Like, make sure that evaluate to see whether the outcome was achieved. Did you get those 5 vital signs? Are they within range? Did they notify you when something was abnormal, right? Then you want to follow up to see if the task was completed. Is the patient stable as a result of it, or there was some harm? You need to follow up. You don't just say, oh, thanks, and then forget about it. You still that's still your patient. You still have accountability. So let's talk about quality improvement. What is quality improvement? We hear a lot about this in hospitals, right? Systematic, continuous actions that can lead to measurable improvement in healthcare services and health status of targeted patient groups, right? You have different QI models. A very popular one is what we call Plan, Do, Study, Act, right? This is where you plan a quality improvement measure, you know, do it, you study the results of it, and then, you act, upon it. Okay, does this work? Does this not work? Right? So the questions that you may ask are, what are we trying to accomplish? How will we know that the change is improvement? What changes can we make that will result from this improvement? So let's look for some QI projects. Go ahead and, visit the NIH, different organizations like National Institute of Health or the CDC or the agency of, AHRQ, Agency of Health Research and Quality. So those websites, go to check out what quality improvement methods that they have. Like a lot of times these things will include quality improvement measures like, okay, we want to reduce house-acquired healthcare associated infections, UTIs, catheter-related QI, measures, things like that. And these are things that in the huddle, the charge nurse usually will discuss with the team, in the morning for day shift and in the evening for night shift, right? So everybody is on the same page. So this is a great video about quality improvement, so made by the Academy of Research and Improvement. So please go ahead and watch this video before you come to class. Right. I'm going to move on to the next one. Now, the next thing I want to talk about is conflict management and resolution, right? Conflict is a part of life. It happens, right? How do we manage it? Especially as nurses, right? And I want you to be able to take this information, right? And I want you to apply this to like daily tasks that we do as nurses, right? It happens at all levels, individual, group, organizational, right? It can happen on the unit, within yourself. You might have individual conflicts. Then it can be a group problem where, you have conflict between a group of nurses or UAPs, just a group of staff. Or you could be at an organizational level where it's very widespread, right? So, we always want a win-win resolution where every party involved gains a benefit, right? We don't want, okay, I win and you lose situation, that's not good. It's not a football game, right? It's real. Like everybody gets points, right? So, and when you identify what are the different steps, right, of conflict management and resolution. Step 1, identify the source of the conflict. What is causing it? What's the cause, the root cause? Step 2 is generating solutions, right? How can I solve this, right? Then step 3, evaluate those solutions, right? Okay, are they going to work? Or do you think this is better? Is it evidence-based? Is it, reasonable? Then you choose the best solutions. Then you implement those chosen solution, and then you evaluate it to see if they worked. Is the conflict resolved? If it's resolved, that means it worked, right? That's it. That's it for leadership and quality improvement. We're all done. I will see you in class.